It's a story we have been following all week. A group of 3 inventors here in Billings, including a neurosurgeon and local dentist, who quickly came up with a solution for the shortage of medical masks in our area. Well, since that first story aired right here on Q2, tens of thousands of people have downloaded the file, producing masks to help those in need all around the world. Q2's Samantha Sullivan has more.
We've had a fantastic community support with the mask, and we are taking donations from the community. We are performing our own quality control process on these. We are sanitizing them, and we're putting them together.
Employees at Billings Clinic assembling these 3D printed masks one by one, cutting and attaching elastic straps, adding padding and filters. The idea coming from a global need for medical supplies, as fear of the coronavirus left shelves empty of items used in hospitals like the common surgical mask. Since publishing their design on Sunday, there have been at least 30,000 downloads of this design from countries all over the world.
We've heard from people in Scotland. We've heard from people all around the country. Yesterday we had phone calls from Orange County, California, from Seattle, from New York, from Michigan, from Florida, from Texas. So all around the world and all around our country. So we know there are thousands of people that are being affected by this, and we hope that this helps.
Dr. Richardson says hospitals hoping to print their own masks need to vet them internally and do their own research to make sure they can perform how they need them to.
If you're using a surgical mask filter patch, this functions as a surgical mask. If you wanted to use this as an N95 mask, you would have to do the appropriate testing with the appropriate patch on that and make sure that it functions in that intended purpose.
Since the initial models were printed, improvements have been made from suggestions of people all over the world, making the mask more comfortable and more effective.
This is about everybody being able to help themselves in a time of crisis, and providing an idea that has served as the springboard for a lot of communities to do projects, to get people involved to solve the problem.
Even with downloads all over the world, there is still a need for more of these masks here in our own community. Dr. Richardson has told me they've had plenty of people reach out with time and resources to make these masks for the medical professionals here in Billings, but they still need more of them, and they're asking anyone with the ability to 3D print or to donate resources to help if they can. Back to you.
All right, thanks so much, Sammy. For more information on how you can help, find Sammy's story on our website, ktvq.com.